I pledge allegiance to the flag
of the United States of America, to the republic for which it stands, one
one
nation,
nation,
under
under
God,
God, indivisible,
liberty,
liberty.
justice for all.
Could we have roll call, please?
Mr. Baker,
Here.
Mrs. Breen,
Here.
Mr. Francis.
Here.
Mr. Hoff.
Here.
Mr. Hoover,
Here.
Mrs. Irwin Adams,
Here.
Mr. Johnston,
Here.
Mr. Cruz,
Here.
Dr. Malloy.
Here.
So everyone's here.
Yeah.
The first item on the agenda is hearing from Reynolds.
Okay, right now Gary is finishing up his quarantine. I sent the board his update. Quite frankly, we have another 20 guys on the job. So we have approximately 80 guys working right now. We will probably pick up another, I would say another 20 or so here either later this week or starting the beginning of next week. The way they have it set up, they can have one person for every 500 square feet. And they feel that they should be able to pretty much run the job completely staffed based on the size of the building and the square footage allotments. It's just a matter of making sure they keep all of their COVID-19 safety, all their safety protocols in place.
Okay, and on our job site, we did have one person test positive for COVID, correct?
We had approximately 2 weeks ago, a worker from RL Abatement was found to have, he was contacted at the end of the day Tuesday that he was exposed on another job for RL Abatement. He then went home. He felt he was running a fever. He went to the doctor the next day. They tested him. They tested him for the flu, which was negative. Then they sent him to Nason and he tested for COVID. He was positive. And that whole area was it was quarantined as of Tuesday at the end of the day. Andy's just coming off quarantine or self quarantine, and a couple of teachers, a couple of electricians. But at this point in time, we should be up to full speed by probably tomorrow afternoon or Wednesday with everybody back who had the potential of being exposed.
Okay, and no one who was exposed has tested positive then?
Not except for the worker from RL Abatement at this point in time.
Okay.
Do we have anybody, is anyone testing the workers?
What we're doing every day is they have the protocol from the CDC regarding their exposure or potential exposure, and the nurses taking the temperature of every person who's going on at the job site, plus all of our employees are going through the exact same protocol every day. So we're taking the temperature of everyone when they come on the site and asking the same set of questions regarding exposure to COVID-19.
So we're paying the nurses anyway, so we don't expect any money from contractors.
We're paying them anyways. And they're also doing all of our people too. And we have 2 nurses on site, one at the field house and then one at the junior high, taking temperatures every day.
So what I'm asking is we're not getting reimbursed by any of the contractors for doing this.
As of right now, no.
Do we look into maybe some sort of
I have Reynolds, our Reynolds working on what the reimbursements will be from FEMA or PEMA regarding the safety requirements for COVID-19. So we are working on that process at this point, but that's as far as we've gotten. Because we also have wash stations, we have hand sanitizer stations, and a whole bunch of other things that had to be installed also. So there's some things that I know JCR will be wanting to put through, and likewise, whether we can recoup anything from the nurses. So
Okay.
we're working on it.
Anything else on Reynolds?
I was told today there are 2 small change orders that I'll be getting out to the committee probably on Wednesday when he gets them to me. And they'll be going out to the board in the agenda from next Monday. I don't know anything more than the fact that he has a couple of change orders to present.
Okay, so moving on, prom and graduation.
Andy
All right, thanks everyone.
and Brad.
So I've been asked tonight to give you an update as far as what the high school has planned in way of recognizing the class of 2020, our graduates. Obviously, you know, major impact with everything and not really being able to do a lot of the things that we normally would for a graduating class. So I know Dr. Priasel has already provided everyone with a copy of the 2 documents that I'm going to just review tonight. I don't know, does anyone want me to share my screen or just go through them? Do you have them there in front of you?
I don't
Does
have
it
them.
matter?
I don't have
Okay,
them.
I'll share my screen with you. So let's see. I think I can do that. Yeah, here we go. Oh, host has disabled attendee screen sharing. Okay, well, if that comes back up, I'll be able to share it. I don't know if the moderator knows how to do that or not, but nonetheless, let me just walk you through what we're doing, and then I can answer any questions. So the first thing we're doing, and actually we're going to distribute caps and gowns to the seniors actually later this week, Wednesday and Thursday of this week. We're bringing all the seniors in 20 at a time, very controlled. We taped off in 6 feet increments, similar to what you probably have seen if you've been out at the grocery stores or anything, basically coming from under the bridge into the auxiliary gym and then through the auxiliary gym. That's where all of our caps and gowns are already staged and organized and ready to go out to this year's seniors. So on Wednesday, every senior, starting on Wednesday, every senior has been given a date and a time to come in. Like I said, those are in 20-minute kind of blocks to help with our social distancing. They all are going to be required to wear face masks as they come in, as will all the staff that are there to assist. They'll collect their cap and gown, much the same as they would have if we were in a normal scenario. Pretty much the same setup in that regard. You know, obviously with the addition of all the social distancing protocols. They're going to collect their cap and gown. That's pretty much it for next week. Then we have a week of normal classes and everything. And then the following week, we are going to be bringing the seniors in so that they can turn in materials, clean out their lockers, all with the exception of their Chromebook, because they need that for the rest of the school year till the end of the academic year. And at that time, we're going to have them come in. I just got word that I can share my screen. There we go. All right, so you should be able to see now my document that I'm working off of here. So they're going to be coming in for their locker clean out. I'm right in here. Seniors also clean out their lockers, drop off materials at this time. And then those senior spots that I was talking about, those are going to be the reason why we're getting the cap and gowns out early is so the seniors can come with their cap and gown. We're going to do a little video spot. It's a simple student walks into the screen, walks into the frame of the camera. Will state their name. They're going to turn their tassel as we state their name, and then they're going to walk off. That'll be for all approximately 521 seniors that we have currently. And then all of that, along with all the other items that go along with the commencement, will also be pre-recorded, edited together by our broadcasting teacher, Mr. Seitz, and we'll be able to broadcast that then. It won't be live, but it will be pre-recorded on the actual day of what would have been the commencement, June 5th. So for all intents and purposes at that point, If everything, if we're not able to get back together and have a traditional commencement, we'll have that for our students. And for all intents and purposes, then at that point we can declare them graduated. Well, Mrs. Bream can declare them graduated as board president. So so that's the virtual, if you will, plan. And like I said, we wanted to make sure we had that because it's hard to say what is going to be allowed and what's not going to be allowed. But then here is what we're thinking if social distancing and some of these protocols are relaxed later this summer. We're shooting for a July 25th commencement. That is going to be held at the Jaffa Shrine because obviously we don't want to hold a lot of people up, so we wanted to make sure we had a nice venue that we could do this with. We'd have a 10 a.m. that's a Saturday, July 25th commencement, same as what it normally would have been. And then we're going to also have a senior prom that evening, the same evening at the same venue at the Jaffa Shrine. Their banquet hall downstairs is excellent and excellent size for that type of an event. It's senior only though. We typically, if we would go junior senior prom, we approach about 1,000 students, well, with our guests. So we're going to do a senior only because we figure the juniors will have a crack at a prom the following year. Hopefully all things return to normal by then for sure. And then we've also been in contact with Lakemont Park, and they're going to allow us to, assuming that everything is still a go, we would be able to hold our afterglow that evening at 12:30. Well, 12:30 a.m., which is typical when we do the afterglow. It ends around 3. So it's a long day. It's kind of a catch-all day for our seniors, but it's a way that we can plan and if we're able to have large group gatherings by that time, that would be our plan, and that's the hope. As we kind of approach the end of the summer, it'll become more and more difficult. A lot of students are already heading off to colleges, the military. So we were shooting for July 25th, and certainly we understand not every senior, if we're able to pull this off, is going to be able to attend just because of other things going on and moving on with their lives. So we know that most of our families and certainly all of our students, if they can be, they would really want to do the live in-person event. So that's what we're planning for. I have penciled us in for the Jaffa Shrine for that date, July 25th. Monies, as far as the reservations and things, we're already able, because we had money in the funds for those different events already that we have not had to spend. We were able to cover all of it. So there's no real financial burden to what we're planning. And the students had already raised most of their money for the commencement. And we feel strongly that we're going to be able to do this for the seniors free of cost because of all the money that's already been raised through the class and everything. So got a lot of people on the back end planning all of this. Certainly was not all my work on this. I have a great team here at the high school, great team of other administrators and teachers that help think this through and that are going to continue to help think it through because certainly we've got the major framework, but we don't have all the details. So I'm going to be quiet now and answer any questions people might have.
Mr. Neely,
Yes, sir.
you mentioned that Afterglow would be at Lakemont Park.
Correct.
That your document under number 3, the last item, it just says on site. Was the original plan to do that at the Jaffa?
Yeah, I'm sorry, I didn't up. That was before Kim Shope just got Lakemont Park, was able to contact. I forget the gentleman's name that manages it, but he's confirmed that we're able to do it there, assuming obviously that all the restrictions are lifted.
Thank you.
Yep.
Well, that wasn't good. Hey, Mr. Neely, I got a question for you. You said the
Yes, sir.
prom is senior only. We're not combining them. However, let me ask this question. If a senior is dating a junior, will they be able to attend with the senior?
Yeah, senior and a guest. So if they're guests, it would be the same protocols that we've always had with prom as far as guest goes. Yeah, good question.
You just made my stepdaughter very happy. Thank you.
Well, let's just hope the 25th is that we're good to go by then.
I hear you.
I just wanted to say kudos for planning something. I know that'll make a lot of seniors happy. So we appreciate your hard work.
Yeah.
Yes,
Thank you.
I think it's a good plan. I've had some phone calls, some parents of seniors that were really nervous as to what was going to happen, and I think this will work. Thank you.
Thank you.
Any other
If
questions?
the board has no objections, are you comfortable with us making this public? We had kind of gave a little teaser out to the seniors when we gave them the cap and gown announcement, told them that there would be more information this week. If there are no objections from the board, are you comfortable with us making this public?
I am, yes.
I think it's a great idea to make it public. So they have an idea we're doing something and at least planning for it. Yes, because I've been fielding a lot of calls as well.
Yeah, I'm good with it, Brad.
I'm fine with it.
Fine with me.
Okay.
All right, just, we didn't want to put something out there before everybody had a chance to hear it.
Yeah,
So,
last thing we wanted to do is to have we want to step off on the right foot. So appreciate everyone's feedback and we'll get it out there. We'll have a lot of happy seniors, I think, by tomorrow morning.
Well, that's good. Thank you.
okay, I need a favor. Andy, if you can go to the streaming, YouTube, and then log off of the Zoom, I'd appreciate it. Doug, if you could go to the streaming and log off of the Zoom, I'd appreciate it. Lori, unless you have something to present at this point, if you could do the same, I'd appreciate it. Okay?
Okay. Have a good night, everyone.
Thank you.
All right, now let me, Zane, you're gonna need to unmute, Zane.
I'm on. How is everybody
Okay,
there?
you want me, I believe I have your presentation up. Okay, I put, you can, if it's all right with you, I'll bring it up and we can run through it if that's good.
Yeah, go ahead. Go ahead.
All right.
Sorry, I just have a quick question while Zane's going on. So I think, isn't this being aired live on YouTube or is it not?
Yes, it's being streamed onto YouTube.
Okay, so the date would already be, I mean, that information that Andy shared would already be out there to the public anyway, correct?
It is now.
Okay, just double checking.
All right, hang on. Let me get this thing to go to slideshow. All
Okay.
right, Zane, can everybody see the slideshow?
Yes.
Okay, Zane, just tell me when to advance, all right?
Go ahead. I'm just glad that to get the opportunity to speak amongst the board to tell you how the program's going. This report's long overdue. So I'm very excited to really show you how well things have been going. You can advance to the next one, please. I tried to keep this simple as possible. We have a more detailed report that Dr. Priatel has, that if you guys want to see any more intricate details about it, but I tried to keep this simple because healthcare is very complicated, believe me.
I'm
Okay,
sorry to interrupt, but I'm still just seeing the original slide. Dr. P, if you're in presentation mode and you just shared the window, we can't see the second slide.
Hang on.
Thank
It
you.
wouldn't surprise me. I'm not an expert at this by any stretch of the imagination.
Thank you for the tutorial, Mike.
No problem.
Okay.
Just
Hang
want
on,
to share
Mike.
your whole screen, not just the window. Dude, share the entire desktop.
Hang on. All right,
okay, you can advance it.
hang on. Everybody see that?
Now we can see it.
Can you see
All right,
it?
I'm just gonna do it this way. I can make this work.
That's good.
Okay.
Yep.
So if you look at when the program began, 2017, 2018, we only had 55 members. And what we tried to do is compare what you would have paid against the UPMC cost. Now, to be fair, we can't simulate the upcharging that goes on. It's not upcharging, but maximizing charging is caused by the health systems. For instance, like we would say an MRI, right? So we would find on the UPMC charge master as much as we could get what an MRI is, but we can't simulate. They add dye, they do a blood draw. We can't simulate all that stuff. So we feel very strongly that this is an underestimation of what the real UPMC cost. So in the first year, as you see, you had 55 members, and you paid us 92,000 and got approximately 77,616. It was the first year. We had to chase everybody to get them in. So as you can see in the second year, though, the school district paid us 139,000 and got 184,475 worth of services. And that's on 123 members. In the third year, we grew again. You paid us 133,214, and the school district got 162,993. The nice thing is, as the membership went up, our price went down. We started out at the program at 170. It went to 140. Now it's down to 128. And as the volume goes up, the price will continue to go down. Next slide. As you can see, the thing that's most exciting, we'd like to reiterate that the acronym of value of our program is not only the money saved on the services we provide through our direct pay network, but also in the way we manage the members, so we generate less costs. As you can see below, despite our ASD population being older and less healthier on average than the rest of the group, in 2019, we saw reduced cost of over $7,500 per employee per year. That's the one thing I want to emphasize is the model, the kinds of things that we're able to do that isn't done in the current system. And as you can see, the kind of oversight that the board has. So to explain this, this is the top line. In 2017, 2018, in that first year, per employee, you spent per employee $8,520. The people, because in the plan, there's people that we wanted to always give people choice. So there's people that choose us and people that didn't choose us. The people that didn't choose us, you spent $10,096. That's a savings per contract per employee of $1,576, a total savings of $4,255. In year two, you spent $11,000 per employee and approximately $3,000 for Empower 3. That's a savings of almost $8,000, $7,877.36 for a total savings of $638,065.98. In 2019 through 2020 so far, on average, and this is annualized, if we annualized it the whole way through, you would spend $4,500 per employee, $11,000 for the people that didn't choose us. That's approximately a $6,500 savings and savings of $642,189.77. So as you can see, not only do we believe that we're getting better care, we're showing savings because we're managing people. And the bigger thing that's really powerful that I cannot emphasize is the care model. For too long, everybody has been looking at healthcare on a spreadsheet. And yes, we can show you how much better it gets in the spreadsheet, but this is human lives. I'll give you great stories. There's one of your members who really didn't having contact with the doctor, came to us. We're able to spend a lot of time with people because, we don't have to worry about volume and these things. Our providers don't see more than 15 a day. The average is 20. We provided a 70% engagement rate with your members as opposed to the national average is 45% because we reach out and get them. But this member came in and had very vague symptoms. In the world that I used to practice 10 years ago, I would have never been able to get a stress test on this person for about a week or two. It would have been very difficult to get a prior auth. But because of our system, we had him to the stress test the next day. He was on the treadmill for a minute and had a sudden cardiac arrest. And thank God all the cardiologists were around him. They were able to shock him, get him back, get him to the hospital, get a stent, couple stents in this gentleman. And he's doing really well now. And he's, on our treatment protocol and doing better. So I think that in my mind as a clinician and as a part of the community is the most important thing. The numbers are great. And I understand this board is under a very big fiscal constraint and have not got a chance to see all this. And lastly, these are the services now. We are, as you know, of all the service before, we have cut contracts with these new providers that your members will have no copays and no deductibles and it was easy to do it because it's really a direct contract with you guys. Now, it's not a flat rate, but you're only going to be paying 165% of Medicare because it does not make sense to capitate something. Most people don't have heart attacks. Most people don't need hip replacements, but we were able to get them to say, hey, they're usually getting 220, 230, take 165% and get it because you're going to be chasing copays and deductibles. And they were glad to do it. So we have on the right, there's new capitated services, mammograms, breast ultrasounds, barium swallows, and HIDA scans. And then these are the new providers that if you have to go to Nason Hospital and you have if you choose to go to Nason Hospital and you have a heart attack, you'll have no copays and no deductibles. If you need replaced, you have no copays and no deductible. And I think we have a very robust new providers, as you can see. So that's the spiel. If I'm sure you have questions, I'll be glad to answer them.
I have a question. The new providers, you're saying that the employee will have no copay or deductible.
Correct.
How's Conemaugh Nason Hospital getting paid or Altoona Dermatology?
Sure, fee for service, but as you know, you guys have reference-based pricing. They've agreed, as long as you're an Empower 3 member, they agreed that you will only be charged 165% of Medicare. With no, like, you don't have to do anything. It's already agreed upon. So it's pretty simple.
Their health insurance would pay that.
Correct. Yes.
So there are fees then.
Correct. Yes. Not for all the things in the blue and the stuff that we already offer, like, the radiology, the cardiology associate stress test, the pulmonary, you're paying one flat rate for all the services, the generic prescriptions, the physical therapist, the outpatient psych. These things that I chose have such a small percentage of usage, you can't capitate it. So it doesn't make sense to capitate it. Everybody will lose out. So, but when you do have it, and you stay in this network, they're charging you an awful lot less than you normally would pay. So it's a win-win.
Why do we need an intermediary to do this for us? Because we're hiring someone that's going to supposedly lower our costs. Why do we have to pay? And I need to go back to slide 2, because what you're putting on there as what we're paying you is not what we're being told that we're paying you. We're told it's $175,000 a year.
Yes, those adjustments have been made, but we have to sit down. We're still going through what has actually been paid and what has not been paid. So me and Camilla are working through all that. But this is what our records show.
So you're telling me when Camilla tells me we would save $175,000 if we didn't utilize your service, that that's not true?
That is not true.
Mrs.
That is
Breen,
not true. That is not true, because if you look at I want you to focus on the top line. The people that chose us, you paid. I mean, really focus on the last page, because like I said, estimating what UPMC would get for those charges is difficult because we can't simulate how well they upcode. The proof in the pudding is everybody that chose Empower 3, you paid a lot less money than the people that didn't.
Okay, so going forward, we have someone else in there with another piece into our policy that's going to control expenses. So the part that you have UPMC cost in those columns is what they're telling us going to go down. And
Yes, yes.
And what we paid you is somewhere between 133 and 175. You're saying you and Camilla are still working on this.
Yes.
I'm just not happy that we don't even know what we're paying. And another concern that I have, the employee has the right to go to any doctor they want. They have health insurance. I've never heard of people providing health insurance, and I've been a business manager for quite a long time, and I've never heard of a company going out and providing health insurance for their employees and then getting another policy where they go to someone else instead of their regular doctor. That's just very confusing to me.
No, see, what you got to understand is the people that choose us still have complete options. They still have health insurance. It's just that if they go to one of these providers, they have no copays or no deductibles. They go to the other providers, they have copays and deductibles. That's all the difference is.
So that's all the difference. You're just basically saving the money for the employee, and we're paying the freight on it. Basically, we're paying for the health insurance we're providing, and we're paying for you. And now we're, $40-some thousand off in this price, which that kind of is very discouraging to me that we don't know what we're paying. And now we're saying we should just continue with this program. I have a problem with that. I'm not saying that there isn't a place for your service. And I remember when you first presented it to the board, it was for people who didn't have health insurance, and it was a way for them to get coverage. And I thought that was wonderful. I just don't know why we are including that in our health insurance coverage that we're providing for our employees.
Sure. I can explain to you that you're not really buying insurance. You guys are self-funded. So it's not like a fully insured product where you're paying a premium. You guys are actually paying the bills, and then you're paying stop loss over the top. So all you're doing by paying us is taking the money that you're spending, you're gonna spend, and you want these folks, right? We have a 70% engagement rate. So we're avoiding that heart attack. We're avoiding that stroke. And if you look at the top numbers, I cannot emphasize enough for you to understand, at the end of the day, it's what you paid in the door and out the door. You don't pay typical insurance. The only thing that you pay for is stop loss over the top and the admin fees. You're actually paying the claims for the MRIs and the CAT scans and the hospitalization, and you have insurance over the top of that. So when the school district sits down and writes a check, right? When they write a check for what services, and our price is included in these services. So I'll give you for 18-19, right? Your total expense for the people that came to us cost the school district $3,100 per member, right? The people that didn't choose our plan that had the same benefits spent $11,000. That is an enormous savings. That's what you got to really look at, is the top line, because that's all that matters. Yeah.
I don't know why you're saying we don't have a premium. When we take it's just like an insurance company. We're acting as the insurance company. We're paying the claims. We truly have a premium, which is the total of all of our claims divided by the number of people and whatever coverage they have. I mean, that's
Correct.
a very simple math issue that anyone can do. But I mean, we are paying for insurance. It's costing us money.
Correct. But no, what I'm getting at is when you're fully insured, you're saying that, okay, I'm going to give the insurance company $651 a month. Okay. I'm not paying any claims. The insurance company's paying the claims. I'm just giving them, no matter what, I'm giving them $640. I'm making this number up a month to cover my insurance. When you go self-funded, right? You guys probably don't, you probably have an aggregate, but you are paying each individual claim out of your budget yourself, not the insurance company. So the insurance company is just covering a certain level above what you're paying cash for. So you're paying for that MRI. You're paying for it. It's not that you're giving the insurance company money and then they pay for it. You're self-funded. You're paying directly for it. The insurance company says every month they come to you guys and say, you had $1 million worth of claim. I'm just making this number up. And you have to write a check for $1 million. When you're fully insured, you pay the $650 and you're out. So if you have a really bad year, when you're fully insured and you paid $650, you're not obligated to pay any more. There's no risk. When
I fully understand that. I work health insurance where I work. I get that. But the downside to that is you have a bad year, the next year your premiums are going up because all insurance is a form of funding. That's all.
Correct. But what I'm making you trying to understand is I really trying, you spent so much less with our fees included for people that chose our program than you spent for people that doesn't. So if you get more people into our program, you'll save more money. We do stuff like, we have a higher engagement rate with prevention. We have a higher engagement rate. If that guy, if that patient came and had a big heart attack or a big stroke, by preventing those things, it saves you money, right? That's what I'm trying to explain.
How do I get out of share screen?
I don't see it. I'm sorry. I disagree. And I'm very upset
Where does it
that
say
the numbers aren't adding up to what we're being told.
Sure. We have, we on
There
our
it is.
end, there was some payments that were missed, and that can happen because over 3 years, like we didn't get paid. So that's what's just getting reconciled. This happens all the time in any engagement in insurance. You have to reconcile the members, some members left, so it's easy that we didn't get paid for some things, and that's okay. We're not complaining about that. We'll get it reconciled.
Well, I don't understand why on our side, we're saying we paid you $175,000.
Well, we will show you the reconciliation. We can't show you what's on our end. We can only show you what we put in the bank. That's all we can
Okay.
show you. I can't. So it's just something that to reconcile. But I think the focus is getting lost here, and I'm trying to get you to understand this because the county is in the exact same program, and they are happy as a clam, happy, outstanding as a clam. And we show them all this stuff, and they understand that they're writing a much cheaper check by the members that are in our program as compared to the members that are not. And you could talk to any of the county commissioners. They're extremely happy with this program. So maybe I need to have a sidebar with you and make you understand it, because it's really a big savings.
Well,
Zane?
not what we're seeing, not what we're being told.
Zane,
Yes.
I want to thank you for stopping in. We're going to have some budgetary discussions and we'll clarify some things, but I appreciate you stopping by this evening.
Yeah, thank you, Sharon. Thank you, guys.
Thank
Really
you,
appreciate
Zane.
it.
You were awesome, bud.
Okay, thank you. We'll see you guys.
Bye-bye.
See ya.
Thanks, Zane.
The thing we did when we did a full audit of this, our actual costs per member versus what we would have paid through UPMC was less. We saved money. Zane talks about, gross fees because he runs a preventative structure where they try to get in front of illnesses, et cetera. And it saves you money because they don't need a lot of advanced medical care. That's the point he was trying to make. My bottom line is, if we're expecting to have a significant savings, it's probably not going to happen the way it's structured right now, because basically we were paying less for Zane's product per person for all the services than what we actually invested. I mean, we would have paid, if they'd have gone to UPMC, we would have paid significantly more than what we actually paid out. So when you talk from a budgetary standpoint, to say to the board, we're going to save 175,000, that's what we should have spent paying the company. But then you look at their usage, and their actual usage, when you break it down to what it would have cost us, we saved money.
Well, then why were we told as a board that the 175 that we were going to save was the premium that we, because that was not in his figures.
He failed to bill us for a quarter, which is the reason his figure for last year is approximately $30,000 or $40,000 lower than it should be.
I just don't understand why we're providing a coverage from what our health insurance is.
Well, the purpose behind going this way was to create a coverage option that, as we move forward through negotiations, might be a way to get some of our overhead costs down by instead of having just one set plan, having some different options on the table that we can therefore negotiate with.
Well, I thought we were dealing with this coming year now, having someone negotiate our claims so that we are not paying as much as we were before. We are going to pay 1% over Medicare, which makes sense, and there's a cost savings.
Yes.
So why are we still going to put another coverage in there? That doesn't make sense to me.
First, our major medical, all of our hospital stays are going through reference-based.
Real quick, Doc, you may want to disconnect Zane's iPhone.
Oh, sorry.
Bye, Zane.
Sorry.
Oh, how do I get rid of him? Oh, I got it.
I'm working on it here. Sorry.
That's all right. How do I do this?
There you go. It's gone.
All right. Thank you. And it's something we can finish discussing, but the reality is our major medical, our hospital stays, all that kind of stuff, that is all going to be reference based. They're still going to have, our employees are still going to have access to mainline medical and all those providers at Zane's level. What we're doing with Empower 3 will save us money at that level. Will it save us money if we do something else differently a year or two down the road? That's another question to be asked. Our concern was we were investing 175 and basically the only people who were using it were healthy people, so we weren't saving anything. Well, when we went through and did a full audit and finally got all the reporting done, we found that we were saving money because they do have reasonably strong usage of Empower. So, and that was the point that Zane was trying to make, that we actually have more usage of Empower than we do in our regular insurance when you're talking about our younger participants. I mean, our average age in Empower, I want to say, is it 30 or 40? Is it 40? 40. Is 40, but our average age of our employees is 32. So our Empower group is actually older than our average employee age. So from that standpoint, those are kind of some of the points he was trying to make. My thing is, if we're looking at it from a budgetary standpoint, I do not see us seeing a significant savings by eliminating it. Just because when you look at apples to apples cost wise, we saved money using it, maybe $10,000-15,000 last year. When you look at, if he bills us for the whole cost, and likewise this year, it's probably a little better, but
Well, this year, we would have actually lost money if he would have billed us what he was supposed to, instead of forgetting a quarter to bill us, because it was 100.
no, last year, we would have still saved money last year, but it would have not have been what he showed us on his slide.
Well, not according to what he had on there. If that would have been 175, he showed 160 some. That was using UPMC. That's before we have this reference based. And that's supposed to bring it down.
Hang on one second, let me check it. It was, last year was 184 and
Unclear to the right.
right, but the point that you make is valid. The changes we made in the healthcare process by going to reference based could squeeze out the margin. You're correct.
Exactly.
We won't know that till after the fact.
Well, but we have a good idea. Well, it's definitely better than what we're doing now, because we're just paying every bill dollar for dollar as it comes in. We're not shaving anything off of it. And we know that,
we are receiving the standard UPMC discounts,
yeah,
which means,
right.
you know, we have our agreed to discounts. We will have better discounts moving forward with the reference-based pricing.
Right.
Absolutely.
So
Significantly.
looking at those figures, it does not pay us to stay with Zane Gates. And let me ask another question here, because I know it's been a month or two ago that Camilla told me that Gingrich was working on getting us a health insurance cost. And I've never seen that, never heard another word about it. What's going on there?
Did we ever get that from Gingrich?
I did not have time to give them the full census and everything they needed. I just did not have time.
We did not get a complete quote from Gingrich.
I didn't have time to give them what they needed.
Are they waiting for information from us, or what's holding it up?
Yeah, it was me giving them this full census and I completely ran out of time. It's my
Camilla is saying she just ran out of time trying to get it all together. The issue with Gingrich is Gingrich is going to the same provider that we're going to. So the chances that we're going to get a reduced rate from Gingrich are slim to none.
What do you mean?
Our reference,
What do you mean they're going to the same provider?
they're going to Pat Riley to get a quote.
They're going to Pat Riley. Okay, because I know some Gingrich people. I'll give them a call.
Right. I know Gary also, and Gary claims that we will get back from him in other ways. He's local and he'll give back in other ways.
At this point in time, we've entered into a contract for reference-based pricing. We will continue to look at this moving forward, but
I think we need a regular insurance quote of what it's going to cost us if we went with a regular insurance company instead of trying to put pieces together and doing it ourselves. And I cannot believe that Gingrich isn't going out to different insurance carriers to get a quote. Now, it sounds like you didn't provide them with the information, so they're being stymied on being able to do anything because they need information in order to get you a quote. And I think we should make some time and get that information to them, because I would like to see a comparison.
It will be top priority.
we will make it a priority and get that done.
Thank you.
All right,
Budget, moving on to
budget.
Well,
All right, I'm
wait,
gonna-
I have a quick question. Sorry. So
It's all right.
if we didn't renew our contract with Empower, or whatever, we're saying here, if we didn't utilize them, does that mean that some of our employees wouldn't have like a doctor because they currently use Empower?
They would have to go back to their previous, provider.
Which could be an issue considering that it's hard to get in with new doctor. I mean, that's one of my concerns, that if we, that we're putting those, I don't know how many employees it was, 60 or maybe 90, that, now they might not be able to seek a new doctor because, you know, every time you try to get a new doctor for something, everybody's full and they're not taking new patients. So I guess that would be one of my concerns also.
At this point, I see your point. That's my thing is with the Empower, we're not going to lose, we're probably not going to significantly lose money if we stay with Empower. We're not probably going to significantly save money if we stay with Empower. But for consistency to our employees, it might make sense to stay the course and continue to research it. The reference-based pricing is where we're going to save.
Exactly. And that's what we should be focusing on, not this. I mean, I think there's a place for Encompass, but I don't think it's as a secondary for our employees.
Okay. I'm going to bring up the finance. I'm going to share the finance slides. And I'm going to turn over to Camilla. And hopefully my machine is going to work. Can everyone see the finance slides?
I'm good.
Yes.
Yeah.
All right, Camilla, you're up.
Good evening. On healthcare, we'll do a quick update and then we'll get into the budget update. The AMPS has been recommended for the reference-based pricing. These are just updates. We are researching removing the built-in legal fee as a potential to save additional money. And then if we need the legal fee to legal support, legal services for a member, then we could outsource it as it's needed. In their percentages, they were saying that only 2% actually go to litigation. So this was one of the recommendations that we could drop that $30 per member per month. It could be around $300,000 additional that we could cut, but we're still researching it to make sure that it wouldn't hurt our members. The Empower 3 agreement will be on the board agenda for your vote on Monday for your decision. Our open enrollment tentative dates will be the day after the board meeting, and we'll run it until the 22nd so we can turn the changes around in time to make the changes for a July 1st start date. And we're still developing the employee education and communication plans. Some employees are coming back. It will be a little easier to communicate and get information out to them, but it's still, with our minimum, trying to keep a minimum number of people around and the social distancing, it's still creating some challenges. In our budgeted revenues, we had mentioned at the April Finance Committee meeting that with the COVID shutdown, it's going to affect our earned income tax revenue as we move forward. And the longer it goes on, the more concerning it is, because we are so retail and restaurant based in this area. And we look at some of these businesses and just wonder how they're going to be able to reopen. So we have taken what we really expect to happen next year. Have a business privilege and mercantile tax decrease, and interest income, the rates have tanked. It's an aggressive, what we expect to happen with our local economy. We based on everything we're hearing out of Harrisburg, when we talked about this at the Finance Committee meeting, we removed the 500,000 projected increase from the state, because that's going to be diverted to COVID relief from what we're hearing. And the adjusted local revenues decrease is approximately 3.8 million, which is more than what we had estimated at the April Finance Committee meeting. I also reduced what we expect for rental income, because if we continue these small numbers where we're not allowed to have large numbers of events, renting our facilities, our rent income is going to go down, and so will our athletic gate receipts. So all of those are reflected in that, in the local and the local revenue decrease. There is a revenues wild card in that there's federal revenue for COVID relief, and that our allocation is just over $2.5 million. We don't know what it looks like yet. The state has to decide how they're going to roll it out and what we're going to be able to use it for. If we're able to use it as a backfill for any of our local expenditures, that's usually considered supplanting, but back in the ARRA days, that's exactly what they allowed us to do, cover local salaries with federal money. So we do not have that included in the budget at all, but it's one of those glimmers of hope, rays of hope on the horizon that might help us if they work it to our advantage. Another option is they'll build it into the state budget and use it to backfill some of the state revenue. That's why we're not counting on it, but it's a possibility. The retirement incentive, thank you very much for approving that. We received 17 letters ultimately after the deadline of last week, April 30th. The estimated cost avoidance ended up with those 17 teachers at $475,000, which is included in the budget numbers that you'll see in the next slides. But the current budget does not include any of the attritions. Brad and Dr. Priatel and Haley and Patty have been working on realigning positions, and those are firming up, and then our budgeted numbers will come down for expenditures after we know how many positions we can actually, if we are able to have any attritions. In the budgeted expenditures, I have included the special ed position that the board approved for the multi-disability classroom at the junior high. It includes the AASD increase that's in the current contract it's at 45 cents per hour. The teacher aides for special ed, the SPOPs, they have another year on their contract. Their increase is at 3.25%, and the budget reflects that. I did adjust our healthcare costs to consider the savings for reference-based pricing and removing the CTC since the board had approved that. The Ebner modulars, we had shown on previous slides that it would be a $70,000 savings, but it's actually, the lease goes through September. We have to pay $20,000 for several months. So the savings will actually be $50,000, which is reflected in the expenditure numbers that are coming. And we did also include the estimated increase in transportation costs of $400,000 that Sue had brought up at the April Finance Committee meeting. So here is an update of the slide that we've been showing at the Finance Committees. And here's a summary of the April Finance, where we were projecting, with no tax increase, an estimated use of fund balance of 7.8. And then when we have made the adjustments for the loss of revenue, the expenditures are fairly close now that we've run it into the system and actually pulled in the approved reductions that have been ongoing. We've reduced expenditures from our current year budget of 114 million down to 111 million. And we still have additional operational reductions through those attritions that I will have in the budget for your vote on Monday. The expenditures will actually continue to come down as we know how many positions exactly there are that we will be attritioning. And then if we are able to sell the Kimmel building and move the alternative ed program to Stevens, the savings for that Kimmel building or an additional 200,000. We won't include that in the budget because it's still too nebulous for 2021, but that would be another potential savings after the school year starts. And then, so that brings us up to a potential $8.9 million deficit. But the COVID, if from that federal COVID revenue, that could make a huge difference if the state passes it to backfill for us. So I've gone through it pretty quickly. Are there any of the slides you want to review, or what are your questions?
What is the $400,000 increase in transportation?
That's the contracted 2.5% increase.
It's the contracted 2.5% increase per year.
Okay, now back to transportation. I had that on my list here to ask tonight. We paid the bus company in full as though they were transporting our students, correct?
90%.
Okay,
90%.
and there was some deal that if they got paycheck protection money, we were supposed to get back the salaries that are paid to their employees. Is that correct?
Yeah.
Okay, what is the status of that? Because anyone that applied for paycheck protection in the beginning, once you got approval, they only had a couple of days to get you your money. And most people that I know of that applied for it already have their money. They've had it for a couple of weeks now. So what is the status of that?
We will check on that tomorrow.
Why aren't they communicating with us? I thought that was the deal.
Yeah, they're supposed to be giving us Act 13, all their complement numbers.
Did-
So I will ask that specific question.
Could you
I
hear?
didn't- No.
They are getting the numbers for Sue, but she will ask that specific question.
What do you mean by getting the numbers? The numbers of what they owe us?
They're providing us Act 13 numbers, so they have to provide us documentation that they are maintaining a complement of employees.
Oh.
So I have that, but I haven't gotten any reimbursement information, and I'll ask that.
Under Act 13, they have to confirm that they've maintained a complement of their employees, and she's going to get confirmation of that. And that's before they could say what their reimbursement would be.
Well, no, they know what their reimbursement is going to be when they file for paycheck protection. I filed 3 of them, I know.
And we will get their exact numbers tomorrow.
Yeah, they need to be forthcoming with that because they definitely should have their money if they were in the first round, because I believe all the ones in the first round have been funded.
But if they didn't maintain their full-time equivalents, doesn't that affect the amount that actually could be forgiven and that they would reimburse us?
That is after the fact. If they're taking money from us to fully pay their employees, because 90% would not affect the pay of the employees. If they're taking money from us to pay those employees and they have applied for paycheck protection and they're not paying their employees, it becomes a loan to them. You're absolutely correct. But why would they be taking money from us and getting paycheck protection and not paying their employees? That would be
We'll find out and get you an answer tomorrow.
okay. And then I guess I have some questions. The Mets employees, when all of this happened, they were all laid off, correct?
Yes.
Yes.
Why is student transportation different? Because both of those are contracted services.
My understanding is that it's the transportation, with the transportation contracts, they have large loans to pay for their equipment, to pay for their bus fleet. And without the support of the school districts, they won't be able, this is what I had read, and this is my understanding, they would not be able to maintain their fleet. And when school does come back, no bus companies would be able to service any school districts because they would have had all their fleet repossessed.
So you're telling me that the state is saying, okay, for cafeteria workers, because they don't have a lot of debt, go ahead and lay them off. That's not an issue, but you have to pay bus drivers not to drive buses, and they're both contracted services. You're telling me that that is what, the loss, can you show me the letter or the confirmation that you got from Harrisburg that says that?
You mean to pay transportation contracts?
Transportation is specifically mentioned in Act 13. It is specifically addressed by the state.
Okay, then
The outsource, the private company contractors for food service were not addressed in any way, shape, or form in Act 13. Transportation was.
could I see the document that you got that states we have to pay 90% to our transportation people? That's all I'm asking for. You obviously have something from the state that says that, correct?
In the CARES Act. We did.
In the CARES Act. Yes, yes, ma'am. We'll get that to you.
Okay, now, back to employees. I know the state said that we have to fully pay our employees. Do they say, because I brought this question up before, and I think I get the answer of, well, we're assuming that's what they mean, that our employees have to be made whole. If we have coaches getting paid to coach and they're not coaching, should we be paying that? If we have people who are in charge of clubs and groups and they're not doing that, should we be paying that? I know for a fact Penn State has put people on half pay. They've cut pay over there. But yet we have to pay everybody everything in full, whether they do the job or not. So, and someone said, yeah, we can check with the state, but I never hear anything back.
We actually had that on for board approval and it was approved at the April board meeting, and we missed the students, and we plan to put the students on for board approval for Monday night.
Right, but the board was told that we had to approve that.
Correct.
Yes, that's part of the act itself. There's been many discussions. We are in the vast majority with what we are doing. Liz, can you give us a little more detail?
Yes, the requirement is to, Mrs. Breen was referencing making them whole. The requirement within Act 13 states that they need to receive no more and no less compensation than they would have received had the pandemic not occurred. And there's no further breakdown or guidance or delineation or exception for hourly employees or employees paid on a stipend. The only qualifying provision within Act 13 states that they have to be paid what they would have received, no more, no less, had the pandemic not occurred. And so that's what is being interpreted as applicable to this. This is specific to public school employees as defined in Act 13. So you may see differences in other places, but that's what's taking place under Act 13 as applied to the states. Act 13 is also what specified the provisions specific to the negotiation of the transportation contracts to continue on, and then guaranteeing the districts could still receive their subsidy if they entered into agreements of that nature, as you were previously discussing also.
Should we, with the coaches, should we hold off giving any coaches contracts until we know what's going to happen with the fall sports? Can we do that?
Well, Act 13 wouldn't necessarily preclude you from doing that because Act 13 expires as of July 1st, but it is something to consider. Or I think what you could do is, hoping that everything will proceed as you would want it to, you could have your board actions be contingent upon normal conditions being in place when you go back, or put a condition on the contracts that you don't get locked into something that isn't going to come to fruition in the fall.
Yes, because it looks like we're back to being 9 million in the hole again. So we've not made much progress, and that's with the savings that we have. And I understand a lot of it has to do with this COVID-19, but the reality is we've got to deal with this COVID-19. We're going to have to deal with these losses in revenue. And I think we have to make absolutely sure that every penny that we're spending is required to be spent. And I think maybe we need a clarification from Harrisburg on this. We're assuming this is what they mean, but maybe making whole means their teaching salary. It doesn't make common sense to me that you have to pay a coach to coach that isn't coaching.
Yeah, I mean, the language is stated as such that they should not receive any more or less compensation than what they would have otherwise received. In the fiscal notes to the legislation, there's reference to adopting the legislation in a manner to alleviate burden on unemployment compensation systems when they know that school districts have their budgets already adopted and have the funds in place. That was the impetus, part of the explanation at least behind it, but that's the way the language reads. Again, it's only in effect until July 1st. It isn't necessarily going to continue through forthcoming year, although if the restrictions remain in place, we may have to see some further developments from the legislature regarding what public school districts should be doing.
Well, can we ask the question of the state, define making whole, no less, because I can understand their teaching salaries, because they are teaching, they are working. But I don't understand why you have to pay a coach or somebody that's in charge of a group and they're not doing.
Well, it's the same with hourly employees, but yes, we are addressing these questions all the time because there was a lack of further explanation included with the legislation, but we can certainly relay it and see what, if there's been any further expansion on it. I'm not aware of any, but
maybe people aren't asking and they should.
We will look at that and we will get you an answer. Pardon me as I unmask. Things that are not reflected in the budget numbers, and these will be reflected by next week. One is the attrition of the any positions, and we will talk about that tomorrow night in executive session. Whether or not we sell the Kimmel building, that's something else. We've restructured ACA, and it'll generate a savings, which is not in the budget yet. And there is also some training adjustments, et cetera, that are being finished up for accuracy, and we should have all that stuff completed. Approximately anywhere from $500,000 to $1 million worth of savings that will be reflected in next week's budget. The COVID-19 issues, the funding, some of this is worst case scenario, just because we have no idea where it's gonna end up. And quite frankly, I have two CPAs who just aren't comfortable without saying this is worst case scenario. So when we're looking at that 3.8 for the COVID losses, it could be different, but it's not going to be higher unless something drastically goes sideways. The monies I just found out today, our numbers, if I may, where is it? The numbers for the revenues is approximately 2.51 million for the COVID relief. There are questions as to how that money can be used. And there's a lot of questions being asked, and we still don't have that finalized as to what it's to be used for. Quite frankly, we're looking at revenue shortfalls because of losses of earned income and losses of mercantile and business privilege tax. That if we can't use it to supplant in the budget, it's going to create a whole different set of problems. But hopefully we'll have more information moving forward. I probably won't have any more information on CARES by next week, but hopefully we'll have it by the time we hit the budget in June. I understand all the savings we have put in and put together. A big chunk have just gotten hammered by the COVID-19 shortfalls of driving the economy. So that's our best update for right now. We're continually working the numbers. I know I've got two very serious accountants here looking at me going, yeah, we can't change the realities, but hopefully we'll have better facts and more complete facts for next week. Any other questions for Camilla?
Yeah, I have a question. Can we go to slide 4?
Sure.
I thought the business privilege tax on the last time we saw this slide was like almost $1 million, like 998,000 or something.
They've run the numbers and they've adjusted it, I'm assuming.
That, I think I hit 40% when I did the presentation and we downgraded that to about 35%.
It went from 40% projected to 35% projected.
Okay. My other question was, and it's probably like all my other questions dumb, but if we do away with the lawyers for the healthcare, will they somehow, like say with UPMC, somehow know that and start challenging everything on us so that, you know, would have to hire an outside firm to do it? Like, would they know that? I guess this would be for Liz or someone.
No, because if they go legal, it's going to cost them along with us to go legal. The way we structured this was to make it as smooth as possible. I discussed this with Carl and we were looking at the numbers and the percentages, and the actual percentage was 0.25% of actual cases that went legal. Well, yes, you're running the potential that you could have a case that would cost us significant dollars, but at the same time, to design and to pay $250,000 just in case we might have a case that goes legal, that's an awful lot of legal fees, Ed.
I know, I'm just saying that if they knew we didn't have that in our clause, they might just do it to run up our bill.
They would do that. They would do that at their own peril.
And nothing precludes you from using legal counsel. It's just that you're not paying for it ahead of time. So they would know that if they brought them in, you probably would have to still go get another attorney. And then really all that they could try to leverage would be the increased cost of doing it from the outside. But they'd still have to incur their costs in doing that as well.
Correct.
Do we have any data to indicate how much of this legal fee we have used this year, the year before?
No, we haven't used it at all. This is all related to reference-based pricing. What we have done, we have actually purchased at an additional charge, which cut down, like right now we're saving projected 1 million to 1.2 million. We could have projected it up to 2 million, but we made it so all of our employees could stay with their current primary care physician. And that eliminated the potential for any kind of legal for that entire chunk of our costs. So, and it knocked down our issues and our potential for litigation severely. So at this time, I feel safe in recommending that we look at legal services on a based on fee per service per occurrence.
And you're saying that we haven't had to use legal services the last several years, correct?
Well, that's because the reference, we've basically been agreeing to pay whatever the bill says.
Right, right. But what I'm saying is, if you go, let's say 3 years and you have no legal expense at all, that's $900,000 in your pocket. If you have a bad year and you happen to have a legal case, you're probably not going to go over $900,000.
Right.
So you're ahead.
Exactly. And if anybody remembers what we do with when we have legal issues with certain special ed situations, it all becomes a negotiation down to what it's going to cost versus what they can get versus what it's going to cost us, etc. So it isn't one of these things where you're going to get sued for so many million and you're going to be out that and all your legal fees and everything else. It's going to be a compromised situation in most scenarios if it even went that far.
So
Right.
if we got charged the bill and they weren't going to accept the reference-based pricing, I'm sure we have history where Camilla could look and see what we paid. And if we just offered them that amount, then we might not even have to go to legal.
Absolutely.
Yeah, I think it's a good cost savings. You may have a year where you're going to need some legal expense, but I think over the years you're going to save enough that if you have that year, it's not going to hurt you financially.
Exactly. The long-term savings is significant. versus the potential for a short-term outlay. Okay, any other questions on the budget? I'm going home to take some Maalox. It's a joke, folks. You can laugh a little bit, okay?
We gotta end here.
No, we have one more. Okay, it's a quickie. It's an easy, okay? Welcome back. I'm gonna pull up food service, which is the cow presentation, right? All right, summer food program. And there you go. Watch the cables.
Just a quick overview. Good evening. Traditionally, we do a summer food service program where we open 6 facilities throughout the district, 1 secondary facility, and then 5 elementary buildings. On a daily basis, we provide meals for 156 kids in the month of June. And that's mostly because of the increased attendance from summer school, and then 322 kids in the month of July. Every year since I've been here, and historically it shows, we lose about $100,000 to $130,000. Now, we make that money up, so we are broke even in the food service program by the time January rolls around, but that's our traditional model. I have some concerns as we're moving forward in this pandemic season. We've contacted the staff throughout the cafeteria. Many of them are uncomfortable working throughout the summer food service program this year. They're all in the demographic where they're in the high risk demographic. So they're not quite sure that they want to do that. Historically, we have had trouble staffing summer food service. As many of you know, we're using our transportation provider to deliver meals right now. Their contract ends when school ends. So in early June, we will no longer have those vans to be able to deliver meals. And then if the governor continues our mandated restriction for social distancing and congregating, we're not going to be able to serve in the traditional model. What I am proposing is that we offer a program where we have 1 preparation site with 4 distribution points. So we would prepare all of our meals at the junior high school, distribute from the junior high, and then take our transportation vehicles, our cafeteria trucks, and deliver to Evergreen Manor and or Baker. I haven't worked out the logistics there yet, to Logan and to Juniata. Based on what we are doing right now, we're delivering almost 1,000 meals a day now. So I'm estimating we would do 5,000 meals a week under this model. What I'm asking is that we would give each child the meals for a week one time. So one child would get 5 meals per day with this distribution center. We would ask families to pre-order meals. So we would open up ordering on Monday, close it on Friday. Then we would have an idea of how many meals we would need to provide for the following week. So if we could also double that, the $5,000 meal number, if we included breakfast in this model. I've talked to technology. We could use Google Docs or some other platform online to allow people to do this. I looked at the numbers on this based on our reimbursement and the numbers out there and the reduced staffing it would need to pull out this model. If we just did lunch, we'd lose about $1,000 a month. If we included breakfast, we'd actually be profitable in this program. So it would give us about $21,000 a month worth of profit. There are pros and cons to this. As you all know, you give all of the meals 1 day per week. All those meals might be eaten one day. So the purpose of the summer food program is to ensure that all of those students that don't get to eat at home have at least 1 meal a day. So if we give them all at one time, we have no assurances that those kids are going to be able to budget the meals, budget the food basically throughout the period. We have concerns that as we give the meals to the families, the food may not be stored properly, because we'd have to give milk, we'd have to give fresh fruits, we'd have to give vegetables. And we would label them, of course, that they needed to be put into a refrigerator or frozen, but we have no assurances that families would do that. It has also been brought up that not everybody in the district would have the ability to place an electronic order. And we don't have the staffing to be able to process manual orders. There are, of course, pros too. This would solve our staffing solutions. It would be one method that we could continue to provide meals to families. And this model, of course, is profitable where the other one was not. I ran through that very, very quickly. What I'm asking is for the board's permission to change to this model for this summer, given the conditions that we're under. And I'm seeking your direction as to what your thoughts and concerns are here.
So the online issue, that was one of the things that first popped into my mind, that digital divide for the kids that, or parents that don't have access to order. Could we partner with like a community organization that has a receptionist that's there and could answer the phone and fill in the Google form on their behalf, or even a business that would be willing to do that? So we could have a mechanism that they could call, knowing that the district may not have the staffing to do it.
That's a great idea. Let me see if I can explore those things and see if there's somebody out there that can do that.
I worry about not feeding these children. To me, it's not about money. These children get these lunches because they need them.
Agreed.
And I'm afraid, wow, some of them are probably losing out right now because the parents can't get there for whatever reason. And I have no idea what that number would be. But to go the summer without having this program, that concerns me a lot.
We're not talking about discontinuing the summer food program. We're looking at using a model that Bellwood and Spring Cove are currently using and State College is currently using to maximize our ability to provide more meals for kids. We do run the issue that they will receive all their meals on Monday, and they're going to have to make sure that they save their meals.
Right.
But at the same time, they will receive a breakfast and a lunch for Monday, Tuesday, Wednesday, Thursday, Friday. And because we can pre-order and set the structure up, we can pretty much guarantee that if Johnny wants that meal, they'll be able to get that meal every week. They'll be able to get 5 lunches and 5 breakfasts for the week, which is an improvement over what we're doing now.
Well, if you look at this model, we're actually providing a lot more meals than we have historically.
And we'd be providing more meals. The staffing problem is simple. Most of our employees for food service are they're well over the age break based on COVID-19, which is where the concern comes, because can we staff a full kitchen 5 days a week so that we can take care of these meals? By doing it with a 1 day and a 1 day distribution, we guarantee we have enough people who can work to get it done. And then we can deliver it and ensure the kids have access.
So what if Johnny's dad wants to eat all his food?
Right.
We have no way to prevent that. Just being honest with you.
And I think that's kind of what we're dealing with in some of these situations. Am I correct?
I mean, we could do it. We could also look at doing it Monday. We give out 2 meals for Monday and Tuesday. And then Wednesday, we give out Wednesday, Thursday, Friday. It still saves us the manpower from the standpoint that our staff, our more elderly staff, would not be exposing themselves unduly because of the pandemic, but likewise, kids will be getting meals.
Well, the minute those meals leave our hands, we have no control over what happens to them. So
exactly.
I mean, if they're not eating in the school, then we don't know what's happening with the meals when they go home. So
there will be more people eating.
Could we piggyback with the Mountain Lion Backpack Program, who seems to reach out to many children who are very much in need of the food and maybe work with them to distribute meals?
That's essentially what this would be.
Well, we're also looking at that option too.
Aren't there other?
But they don't, but Mountain Lion Backpack does not operate in the summer.
Aren't there some other groups that are providing the summer lunch program? That Right Place for Kids, don't they have a program there?
The Right Place for Kids has a program, yes. I'm not sure of all the other food kitchens / food pantries, but obviously, you know, we're going through 900 meals a day right now. So the idea that we could include breakfast and actually get it to the point where we have no exposure is beneficial, because we're providing more meals and more food for the full week. And it's whether we do 2 distribution days, or we do 1 distribution day, obviously 2 distribution days is going to impact the bottom line, but we're not going to be going as far into the red with 2 days as we do with 5. And the issue comes down to it's staff, the age of the staff, and the people we're asking to come in. They're highly susceptible, and their concern is they don't want to put their health at risk. So that's what we're working for.
Right, I understand that. I worry about these kids not getting fed when we normally feed them. Now, in your summer food program, do the parents normally come with the child, or does the child come by itself?
Both, and the parents can pay a fee.
A little of both. And the way we used to do it, the parents could pay a fee and eat. They could purchase the lunch. I do not know how often that happens. Minimal parental participation during the summer.
Okay.
Hey, so are the cafeteria people paid whether they come in or not?
The summer food service is different. Their contract ends when school ends. This is a different thing. This will not be impacted. To my knowledge, this will not be impacted by Act 13.
Now we
I
get
will seek the legal answer to give it to you definitely, but I believe it would not be impacted by Act 13.
Yeah. Do we get funds for this from the state or the federal government?
Federal, state. Okay, it's state funded.
Okay.
I know that I'm pleasantly surprised that by providing 2 meals, it actually becomes cost effective. I know my sister delivers for another school district, and she delivers 3 meals a day, and they go out 3 times a week, and each time they go out, they take 2 meals with them. So, and literally, it works through the week that way. But that's their situation. Each situation is different based on your reimbursement and your amount of free and reduced lunch.
So they're reimbursing you more for breakfast than for lunch?
No, what is happening is the reimbursement, the amount of man hours it takes to add breakfast onto the meal plan does not counteract the extra reimbursement. So therefore it takes it from black to puts you in the black from the red.
They're obviously not getting hot food then at any of these.
This would not be hot food.
Well, this would be the components for hot food.
This would be the components for hot food. I have been corrected.
Yeah, they would cook it at home.
And then they would cook it or heat it at home.
Okay,
But it's fully cooked when it leaves.
right.
So they would
right.
reheat it like in a microwave. It could be chicken McNuggets, that kind of stuff.
So they're dependent on the parents to do that for them,
Some of them are, yes.
unless they're
Obviously,
teenagers.
the younger children would be yes.
Yes. Well, that's the part that concerns me. I don't know how anyone else feels.
Well, I mean, it's a concern, but there's no way to control that. We can provide the meals. Once it goes out of our hands and into theirs, that's the only thing we can control, if I'm understanding that.
The issue we have is congregation rules. We just can't have a hot meal that we serve a hot meal and they sit down and eat it, because they won't be allowed to congregate. So we can't do it the meal structure would, the way the meals are provided would be the same, no matter what. The question is, do we distribute 5 days a week from so many points where we know we're going to have a manpower issue in making that happen? Or do we do it 1 day a week or 2 days a week and give them so many days worth of meals at a time? Because we're not going to be able to have a congregation point where they can sit down and eat.
So
Yeah.
what type of lunches would we be providing? Because I know, like, I can't assume that every child has a refrigerator or freezer or even an oven to prepare any food. So I guess that's another one of my concerns.
Go ahead, Sue.
What we're suggesting is that we, in the online ordering process, we provide various options. So one of the choices would be cold cut sandwiches. So the components to make a ham and cheese sandwich or to make a turkey and cheese sandwich. So those would not need to be cooked. So if the family didn't have a microwave or a means to cook it, they would be given meals that they could just pull out of a refrigerator and eat. The other option is that we would provide chicken patties or chicken nuggets or pizza slices or something like that somebody would need to throw into a microwave or throw into an oven and warm up and eat. So we were going to give both of those options for families to choose from. And the breakfast cereal that we would give would just be, like a whole grain breakfast, the Fruit Loops or the Cheerios or something like that. That's FDA approved meal products.
Okay, thank you.
Mm-hmm. Anything else? You're back on.
Okay, folks. That's all we have for this evening. Tomorrow night, we have executive session at 6 o'clock with, we have 4 items, different in nature. I will go over those tomorrow. And any other discussion we may need to have from an executive session standpoint, we can handle that tomorrow evening. Are there any other questions regarding any of the topics we went over tonight?
No questions. How about a comment? It's National Teachers Appreciation Week. I think that shouldn't go unnoticed. I know there's probably a lot of people watching now that they can't attend. I know it's a cow, but I know several people who were going to watch because we were covering some topics they wanted to see. I think right now the teachers need a pat on the back. They're doing yeoman's work here, and I think that needs to be recognized. So please just remember this week, appreciate the staff we have. They're doing great work. Everybody's doing awesome. So that's all I got on that one.
Anything else? Any other comments? Sharon?
If there's none, I guess meeting is adjourned.
Thank you, Sharon. I'll see everybody tomorrow night.
Night,
Okay.
everybody.
Bye-bye.